Right, okay, cardiology this time. Hello Sanjay. Hello. My name's Rob, I'm one of the doctors here. Do you mind if I examine you? Okay, first thing you've got to do, Sanjay's now lying here flat. And for a cardiac examination, you've got to be at 45 degrees. So Sanjay, if you'd just like to sit yourself further up the bed. Sit yourself right back there. Perfect. Then, as ever, stand back and have another examination. Just an inspection of what you're likely to see. Now, with anybody like this, you want to make sure they're comfortable, relaxed at rest, so you can comment on their breathing pattern, whether or not their mouth is open or closed, whether they're gasping for breath, do they look blue. Also have another look around the bed for other clues of what may be around them, perhaps an oxygen mask, perhaps a GTN spray, perhaps even a packet of cigarettes in the pocket. Anything that would give you a bit more of an idea that this is a cardiological patient. Next thing, moving on to the hands, as ever, examine both hands. We're looking for splinter hemorrhages, which can be a sign of infective endocarditis. We're looking for clubbing as well. With clubbing, you need to look at all the digits. Then you need to make certain comments with the other examinations. Look for an exaggerated longitudinal curvature of the nail. Feel for bogginess. And then finally, if you put two fingers together, look for the diamond in between. If you've lost that, then it usually implies that there's clubbing. And never forget, you can also get clubbing of your feet as well. Turn the hand over, make a comment about palmarothema. If the patient drinks a lot of alcohol, they may be presenting with a dilated cardiomyopathy. Next thing, you're moving on to the pulse. Feel the pulse for 15 seconds, two fingers over the radial pulse. And what you're feeling while you're counting for the 15 and then times it by 4 to get the minute's worth is rate, rhythm, and then finally character. 15 seconds and then you're done. This examination is nice and smooth. It starts at the hand and it just walks all the way up. Next thing what you want to do is feel for a collapsing pulse. Now a collapsing pulse can be associated with aortic regurgitation or aortic incompetence. Place two fingers over the radial pulse. Next thing, hand goes round the belly of the forearm. Bring your arm below heart height and then you lift it up. If there's a collapsing pulse, you get this backflow of blood, this pressure wave drops down, and it actually squeezes against your hand, so you can almost feel like a tap. So where you're actually feeling it is on the bulk of the forearm. It's sometimes called a water hammer sign. It was an old Victorian Christmas toy, which was a bit like a dumbbell that had water in one end, and you turn it over upside down and the water rushes through. So that's the kind of feeling that you get there. You can feel the brachial pulse if you want to. Next thing, you're up onto the forearm, and this is where you would now do your blood pressure. I'm not going to do it in this part here. Walking all the way up, straight up to the eyes. Next thing you want to do is just make sure the patient's not anemic. Thumb under the finger, lift the lid down. If the patient's anemic, they may present with cardiac failure or with chest pain. Sometimes you'll see, and it's a bit of a rare sign, but if you want to be flash, you can mention about a malar flush. A malar flush on both sides is not like a butterfly rash, it won't go over the nose, and that's associated with mitral stenosis. Next thing, moving down to the lips, just check for cyanosis, just open your mouth, pop your tongue out. Good, pop it back together again. And if you want to be ultra flash, you can also make a comment about a diagonal earlobe crease. Now this has an association if it's bilateral, not if it's unilateral, with cardiovascular disease risk. Next thing, look for the JVP. Pop your head back on the bed. Turn over to the left hand side. Now we're looking at the internal jugular vein, not the external jugular vein. If you want to make this look a little bit bigger, you can do the hepatojugular reflex. Take your hand, put it over the liver, just say to the patient, I'm just going to press on this now, and whilst you're looking over there, you can press and you'll see it highlighted. If you want to get your boundaries, always remember, look at the anterior border of sternocleidomastoid going all the way up to the ear. And you'll see the external carotid, the external jugular course and elongate. We're not interested in that one. We're interested in the one that just sits behind. Okay, back to the central point. Now we're moving on to the chest. As ever, inspection, palpation, percussion, auscultation. First thing you want to feel, apex beat. Apex beat anatomically is in the 5th intercostal space, mid-clavicular line. So you take your hand and you feel for the point of maximum apex impulse. Once you've found that, go to the midline point of the clavicle and count it down rib by rib. It should be in the 5th intercostal space, mid-clavicular line. Whilst you've still got your hand on the chest, now you want to check for thrills and heave. Thrill is a palpable murmur. Heave is just the whole dynamic moving of the chest. So you feel it over the left side, come along the top, come back down that side. The thrill is felt like a bit like a fluttering just underneath there. We've now done palpation of the chest. Next thing you want to be doing is listening. Now with your stethoscopes, and always make sure you get it in the right way around, they go forwards. With your stethoscope, now you know where you are, listen with the diaphragm first. If you've all got a flash stethoscope they can turn on and off, just rub your fingers so you know which way it's on. We're on diaphragm first, listen over the apex, just a couple of seconds, and then you can move on. Next thing you want to do, switch it round to the bell. Don't press tautly on the skin. If you press tautly with a bell on the skin, you just turn it into a diaphragm. Now we're going to listen on the left edge, and what we're doing here is listening for the low-pitched murmur, the mid-diastolic murmur, which is mitral stenosis. Ask the patient if there's any pain in the shoulder. Sanjay, any pain in your shoulder? Just lift your left arm behind the back of your head, just roll over onto your left-hand side for me, and with your bell, listen around. Couple of seconds, move back. That's fine, come see yourself in the back. You just get yourself back to 45 degrees. Back to the diaphragm. Now we're listening at the left sternal edge. Now we're moving up to the pulmonary area. Now we're moving across to the aortic area. And all I'm doing is I'm just getting a couple of heartbeat cycles in and listening between systole and diastole. Next thing you want to check for an aortic stenotic murmur which radiates up to the carotid arteries. So if you just turn your head over to the left and listen to the commands on this one. Take a big breath in, breathe all the way out, hold your breath there and breathe away. Clear commands on that one. Next thing, get your patient to sit forwards. Same again, but this time listening at the left sternal edge again with your diaphragm. We're now going to listen for the murmur which is best heard with the breath held in expiration, and that's aortic regurgitation. So same commands again, left sternal edge, big breath in, breathe all the way out, hold your breath there, a couple of cycles, and breathe away. Now your patient's in a good position now to complete the examination by listening at the lung bases. Big breath in, and out, and in, and out. Sit yourself back. Next, moving on to radial delay. So that's looking for coarctation of the aorta. And finally, radiofemoral delay. You can make a comment if you want to listen further down as well. And that's the end of the examination. At the end of the examination, you'd always turn to the examiner, you'd ask them if you could do a couple of things. And for a cardiac examination, you probably want to say, I'd like to do an ECG. That's the end of it.